Good afternoon, coaches. Welcome to today's seminar. A heads up, this is going to be a talk about concussions. My name is Coach Soto, and with this seminar, I will be providing you some steps on what to do as far as assessing a concussion, treating a concussion, and when to decide when a return to play from a concussion is safe for our athletes. So first, what is a concussion? A concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head, or a hit to the body that causes the head and brain to move back and forth rapidly. What are some symptoms? So symptoms first may be onset or delayed. So this means that your individual may experience the symptoms right after the collision or even minutes after the collision. So that would be delayed. And so what are some symptoms to look out for? Your individual may experience persistent headache, sudden fatigue. They may or may not lose consciousness, amnesia. So your individual may have a hard time remembering things that happened right before the injury or even right after the injury. Visual disturbances. So, for example, looking up at lights may be hard for the individual. Behavioral changes, cognitive impairment, just having the trouble understanding what you're telling him, or just having a hard time thinking in general. And then sleep disturbance as well is known to be caused by concussions. So what to do? So you as a coach are to immediately remove the athlete from play. You are to perform cognitive imbalance tests on the individual. So some examples of this would just be asking them questions like, what's the score of the game for in-game situations? What'd you eat for breakfast today? What'd you do at school today? When's your dad's birthday? Things like that, to see how the individual is thinking and to see if they're thinking okay. It is preferable to monitor the individual when at home following a concussion. Obviously, this is not always possible. Some individuals do live alone, but if you're a coach and you know that your player has a roommate, maybe I encourage you to encourage them to, your roommate just suffered a concussion. Maybe try to monitor him a little bit, make sure he's okay. And so of course, all symptoms must be resolved before allowing a return to play, and a return to play must be gradual. Do not try to force anything. Do not try to rush anything. As we will see a little later on, there is a minimum as far as days to when your athlete should return to contact. So some more info on concussions. There are approximately 3.8 million sports-related concussions per year. For males, the highest incidence for concussions happens in football, followed by hockey. And for females, the highest incidence is in soccer. And this really just goes to show that concussions are prevalent in all sports, from basketball to soccer to baseball to hockey to cycling to diving to gymnastics to boxing. They're prevalent across all sports, and they should not be taken lightly. Especially us as coaches, we need to be on top of this as soon as possible. So an interesting fact is that more than 85% of concussions heal fine, but only if managed correctly in the first days to weeks following the injury. And I would really just say it's the first days that's really important, because when it comes to weeks, you've already done enough damage to your brain if you haven't diagnosed a concussion by that time. So as a coach, it is important that as soon as the injury happens, to raise questions, to ask questions, and so manage correctly first few days, hours, minutes, seconds after the collision or injury happens. So in 15 to 24-year-olds, head injuries in group sports are second only to motor vehicle accidents. To put that into context, you can hurt your head in a car accident, you could hurt your head in group sports, and then everything else. So it's kind of crazy when you think about it like that. So evaluating, preventing, and rehab. So as far as evaluating or assessing, SCAT-5 is the most widely used assessment tool for diagnosing concussion. SCAT-5 is stands for Sport Concussion Assessment Tool. Simple as that. You could look that up. It actually provides us coaches a guideline as to certain questions that you could ask the individual. It is the standardized method of assessing concussions from health professionals. And this is a test that takes into consideration symptoms, cognition, balance, and of course coordination in our athletes. Um, so this is very helpful, and I highly recommend you look into it. So prevention. So us as coaches need to preach correct form, need to preach self-awareness, knowing where you are in time and in space. We need to encourage working on our balance to stay upright as much as possible. Strengthening our neck muscles is important to help with that whiplash from certain collisions. And the use of mouth guards is something that often goes, you know, it doesn't get enough credit, because mouth guards really do help with jolt-like injuries. If you have your mouth guard in your mouth and you get a jolt to the head, not having that can lead to a lot of pain. So you as a coach need to prioritize, or need to make it known that mouth guards are mandatory, especially with sports like football or hockey. And of course, keep your equipment up to date and use proper equipment for the specific sport that you are playing. If you have suffered a concussion, you are to scale down cognitive activity for 3 to 5 days after injury and progressively increase the load. So what this means is that for tests, assignments, and time to study, your athlete should benefit from extra time to study, extra time to turn in tests, and extra time to turn in assignments. And you as a coach need to fight for that. All symptoms must be fully resolved before returning to play. While some symptoms may resolve in 7 to 10 days, it is recommended to hold the athlete from contact for 10 days after injury minimum. 10 days, you heard it here first. Do not return an athlete before that. Failure to protect your athletes can lead to recurrent concussions, which produce a traumatic brain injury known as CTE. Chronic traumatic encephalopathy is not something to take lightly and is a progressive and fatal brain disease. Please pay attention to our athletes and hold them to the top priority. That is today's seminar. Thank you for coming, and enjoy the rest of your day.